Hi everyone, I'm U.S. Surgeon General Jerome Adams, and I'm joined by one of our U.S. Public Health Service nurse practitioners and my Chief of Staff, Captain Joel Dulaigh. Today it's my honor to present the Surgeon General's Medallion to Dr. Loretta C. Ford. Dr. Ford has worked her entire life to make healthcare more accessible to the public and has transformed the profession of nursing. She completed her Master's of Science in Nursing at the University of Colorado Boulder in 1949 and continued her studies while practicing as a public health nurse, earning her Ph.D. in nursing education from the University of Colorado in 1961. By 1965, she was a full professor at the University of Colorado College of Nursing. In the early 1960s, Dr. Ford discovered that because of a shortage of primary care physicians in the community, health care for children and families was severely lacking. In 1965, she partnered with Dr. Henry K. Silver, a pediatrician at the University of Colorado Medical Center, to create and implement the first pediatric nurse practitioner concept and training program. The program focused on a holistic approach, teaching nurses to factor in the social, psychological, environmental, and economic situations of patients when developing care plans. The program became a national success in 1972, and Dr. Ford was recruited to serve as the founding dean of the University of Rochester School of Nursing. During her 15 years at the University of Rochester, she provided administrative leadership for the integration of practice, education, and research in nursing. Her vision of creating new roles for nurses with the use of the unification model is a vision that has made nurse practitioners an integral part of our healthcare system. From a program that graduated one student in its first year at the University of Colorado, over 30,000 students completed nurse practitioner programs last year. Today, more than 290,000 NPs are licensed in the United States. Dr. Ford is regarded as one of the most influential nurses of the 20th century, yet she deflects all attempts to give her credit for her incredible work in the existence of the nurse practitioner. Dr. Ford has said that the credit belongs to those first nurse practitioners who showed the world what they could do, those courageous pioneers and idealists, gifted and knowledgeable. Dr. Ford has been outspoken towards anyone critical of nurse practitioners, saying, "I've found the only way you can deal with critics who are not going to change is to outlive them." Dr. Ford turns 100 years young on December 28, 2020. I'm confident she has outlived many critics. Dr. Ford, thank you for the difference you have personally affected for millions of people, not only in this country, but around the globe. It is with great pleasure that I present to you the Surgeon General's Medallion.
Congratulations, Dr. Ford.